Today, we're diving into something that sounds like it's straight out of science fiction. We're talking about using sonar, sonar, to see inside the human eye. It's this incredible technology that lets doctors navigate the hidden world behind our lens, especially when their own vision just can't get through. So imagine this problem. A patient comes in, but the doctor literally can't see the back of their eye. Maybe there's a cataract so dense it's like looking through a frosted window. Or maybe there's internal bleeding that's just clouding up the whole view. The question is, how do you diagnose a problem you can't even see? Well, the answer is just so elegant and incredibly clever. You stop trying to use light, and instead, you use sound. And that, right there, is the core idea behind ocular sonography, a technique that has totally revolutionized how we see, understand, and treat the eye. So what is it exactly? Ocular sonography is a totally non-invasive way to get a look inside. A small probe sends super high-frequency sound waves into the eye. As those waves bounce off different things inside, like the lens, the retina, or maybe even a tumor, a computer listens to the echoes. Then it translates those echoes into a detailed picture. It's absolutely essential when a direct line of sight just isn't an option. Okay, so the first and, most common tool we've got in this toolkit is called the B-scan. The easiest way to think about it is as the master map maker for the eye. Its whole job is to give us a big, two-dimensional overview of the entire landscape inside. The B&B scan, it stands for brightness. And that name tells you exactly how it works. The stronger the sound wave echo that bounces back, the brighter the little pixel on the screen. So really dense stuff, like the wall of the eye or a detached retina, shows up as bright white. Meanwhile, things like fluid or blood show up in different shades of gray. What you're getting is basically a live anatomical slice of the eye. Now, check out this number, 30. This is where it gets really cool. This isn't just a static photograph. The B-scan probe is firing off these images at about 30 frames per second. What that means is we get a live, moving, kind of movie-like view of what's happening. Doctors can actually watch how things move, which is so important for telling the difference between, say, the slow, wavy movement of a detached retina and the much faster motion of something like a vitreous detachment. And this is where the B-scan really becomes a lifesaver. You can use it to spot a retinal detachment that's totally hidden by blood, find tumors that could be cancerous, or even just get a good look at a dense cataract before heading into surgery. It turns a complete clinical blind spot into a crystal-clear diagnostic map. All right, so if the B-scan is our map, the A-scan is our super precise ruler. We're about to shift gears here, going from a 2D picture to a super focused, one-dimensional measurement. Yeah, this slide just lays it out perfectly, right? The B-scan answers the big question, what does the inside of the eye actually look like? It's all about visualizing structures. But the A-scan, it's asking a totally different question. How long is it? It's all about measuring the distance between those structures with insane accuracy. This time, the A stands for amplitude. So instead of a picture, you get a graph with a bunch of spikes. Every time a sound wave hits a surface and an echo comes back, boom, you get a spike. The time it takes for that echo to return tells us the exact distance. Its most important job by far is for cataract surgery, calculating the exact power of the new lens a patient needs. You have to get that measurement right. It's everything. Now, this graph might look a little intense at first, but it's actually telling a very simple story. That first big spike on the left, that's the sound wave hitting the cornea, the very front of the eye. Those two spikes in the middle, that's the front and the back of the lens. And that last really strong spike at the end, that's the retina. By measuring the distance between these spikes, we get the exact length of the eye. It's simple, but it's brilliant. So, we've mapped the eye with a B-scan, and we've measured it with an A-scan. But what if we need to zoom in, like way in? For that, we need a really specialized high-powered tool. And that's Ultrasound Biomicroscopy, or UBM for short. The secret to UBM's power is all about frequency. A standard B-scan uses around 10 megahertz, right? Well, UBM cranks that all the way up to 50 megahertz, sometimes even higher. And in the world of ultrasound, it's a simple rule. Higher frequency means higher resolution. You're basically trading depth for an incredible amount of detail. So what does that crazy high frequency get us? This. An axial resolution down to 23 microns. To put that in perspective, a single red blood cell is about 7 microns across. We are talking about seeing things practically on a cellular level. It lets doctors see the tiniest, most intricate structures at the front of the eye like they never, ever could before. So let's just sum up UBM real quick. Its target is the front of the eye, the anterior segment. Its huge advantage is that microscopic resolution and the ability to see behind the iris, a place that's normally hidden. The main drawback? It does require direct contact with the eye. All this makes it the absolute best tool for really complex cases, like angle closure glaucoma or checking out tumors right at the front of the eye. Okay, so we've talked about all this amazing technology, but here's the thing. The machines themselves, they're only half the story. The other half is the art and the science of interpretation. I mean, having the image is one thing, knowing what it's telling you is everything. A really skilled operator relies on three key things to read these images. First, there's real-time analysis. They're watching how things move to tell different tissues apart. Second is grayscale interpretation. They just know what all those different shades of gray mean. And finally, they're doing a kind of mental 3D reconstruction, taking all those flat 2D slices and building a complete three-dimensional map of the patient's eye in their head. And ultimately, this is what it all comes down to. A great diagnosis isn't just about the fancy machine. It's about an expert using their deep knowledge of anatomy, their skill in placing the probe just right, and their feel for adjusting the settings to tease a clear story out of these sound waves. It's all about turning those silent echoes into life-saving answers. Ophthalmic ultrasound has given us this incredible window into the eye. It's transformed what was once an unknowable black box into a landscape we can map, measure, and even examine on a microscopic level. It really makes you wonder, right? As these tools get even more powerful, what other hidden structures are we going to be able to map out next?